Being board meeting on Thursday, 13th of November, and thank you for all coming. So this meeting will be live recorded, both audio and video, so make sure that your personal things are not exposed to the camera. Can we start recording, please? Okay, thank you. So as ever, we will start with introducing ourselves to each other. And before you do, you press the button on the right button on your microphone speaker so that we can hear, everyone can hear. So I am the chair for this meeting. My name is Paul Ejil-Shelvan. I'm councillor for Cramlington South East.
Morning everyone, I'm Luke Robertshaw, Deputy Director of Public Health.
Morning everybody, Audrey Kingham, Exec Director for Children, Young People and Education in Northumberland.
Morning, I'm Alan Smith, I'm the Councillor for Cramlington Eastfield.
Hi everyone, Neil Bradley, I'm the Executive Director for Adult Services here at the Council.
Morning everyone, Ashley Easton, Head of Public Health Nurse and up in here in Northumberland and Gateshead for Harrogate and District Foundation Trust.
Morning, Sharon Williams, Community Pharmacy North of Tyne.
Good morning, Carl Green, Councillor for Seaton with Spittal.
Morning everyone, Helen Vizzocchi. I'm here on behalf of Lindsay McVeigh from Northumberland Fire and Rescue Service.
Good morning, I'm Janet Harris, Deputy Director for Delivery at North East North Cumbria ICB.
Good morning everyone, I'm Kevin Waring, Police Superintendent for Northumberland.
Good morning everyone, I'm Laura Jobson, Associate Director with CNTW. I'm here on behalf of Chloe Mann this morning.
Good morning, I'm Derry Nugent from Health Watch Northumberland.
Good morning, I'm Jane Walker. I'm Head Up Mental Health, Learning Disabilities and Neurodivergence for Northumberland and North Tyneside Local Delivery Team.
Good morning everyone, I'm Yvonne Hosh. I'm a Public Health Manager here at Northumberland County Council.
Morning, Abby Conway, Chief Exec of Citizens Advice Northumberland.
Andrea Todd, Democratic Services. Chair, we have apologies from the Vice Chair, Councillor Sanderson, Councillor Renna Thompson, Jill O'Neill, Hugh McKendrick, Lindsay McVeigh and Chloe Mann.
Thank you. Thank you very much. About the minutes of the last meeting, 9th of October 2025, shall we agree that this is a true record of what we discussed? Thank you. And disclosure of members' interest. We will have 3 items, 2 on mental health and 1 on Citizens Advice Bureau. So if you have any interest in any of these things, can you please declare it now? There's none I see. So let's go to the first major item on community mental health transformation work. There will be a brief presentation from Jane Walker, who has been leading this initiative in our council, in our county, for quite a long time, I think, isn't it? I think 2019-20, during COVID lockdown, it became apparent there are lots of mental health issues, latent or open or whatever. So it became a major issue. So I think we are one of the councils to start early addressing the problem. I think I must really appreciate our public health department as well, public health department within this one. So we have been doing some transformational work, and Jane Walker is going to give us a presentation. At the end, we are recommended only to note the presentation, but any questions and discussions are very welcome. Okay, thank you. Jane, it's yours.
Thank you. I'll just wait for that presentation to come up. There we go. Lovely. So I introduced myself earlier on. Thank you for inviting me to come along today. And as Chair mentioned there, the community mental health transformation work's been taking place over quite a period of time now, so a good 4 to 5 years. So I'm doing a fairly swift presentation through what is around about 4 to 5 years work. So let's just crack on then. So just to give this a little bit of context then, the transformation work is a national initiative. It began around about 1920 and it brought with it national monies as well. So monies that flowed down centrally through to what was clinical commissioning groups at the time and has now continued on through our local delivery teams. And as you said earlier, Chair, really this was around trying to address some of those continued health inequalities that we see for people with severe mental illness. And at the same time, following COVID, we saw a significant rise in mental ill health. And that was across all ages, not just adults, but also our children and young people, which we're also continuing to feel now and can be seen through the demand for our services. So the principles behind mental health transformation are really about how we can help to improve our services by making them more accessible, ensuring that there was really no wrong door for people when they required support. And thinking about mental health has really been everybody's business. A significant number of us will either have friends, family, or ourselves will come across a mental health issue at some point in our lives. And also in thinking about that, how we take a trauma-informed care approach to mental health. No wrong door is really important because it's about how it's all of our business. And so if somebody approaches a service requiring support and it's not the right service, it's about how do we ensure they get to the right place at the right time. There's also a real emphasis on improving the physical health of people with mental illness. We know that those people with mental ill health often don't address their own physical health needs and need support to be able to do that. So there was some work around how we can improve awareness about physical health and also looking at parity of esteem between physical health and mental health and how important the two are together and how interlinked they are. A key thing about transformation was around how services and different areas of our whole health and social care system work together. So there was really a lot around integrating our services, and that includes our voluntary sector, our local authority, social care, primary care, secondary care, all of those different organisations and the part that they play and how they can play a greater part working together and acknowledging each other's strengths and weaknesses. So creating that level playing field, and that was particularly important for our voluntary sector as well, really recognising the role that they play and bringing that to the fore. So again, I've talked about somebody telling their story only once. It can be incredibly frustrating to be bounced from pillar to post, different services, talking to lots of different people. It can be, it's tiring, it's wearisome, and especially difficult for people with a mental ill health. And we've talked about bringing services closer to home and in the communities, and we are doing a lot of that at the moment with our Safer and Resilient Communities team at the local authority, thinking about how we can look at those local assets that we have and bring together our local services to make better use of those. So there were some key pathways that were identified in terms of use of some of these monies, these central monies. Those are around developing a community adult eating disorder pathway, looking at our complex emotional needs cohort of clients and what we can do to support those in a better way, and also to look at our rehabilitation pathway. So this is a very busy slide, and I'm not going to go through all of it in detail, but what it does do is give a very quick overview of the sorts of things that we covered on our journey. A couple of things to point out. In Northumberland, the first thing we wanted to do was really harness the way that we as a system in Northumberland work together. We're really good at this in Northumberland. People coming together, being very transparent, being very clear about where we think the gaps are and how we work together to address those. And I have to say that has been a key element and a key reason as to why this has been so successful in Northumberland. I know you all know that, but I think it's really important that we raise that point here. So we did get together a steering group in the very early days, a leadership forum, and we pulled together a structure of working groups as well that fed up to that leadership forum. So we were always on track, we always had a really good structured idea of where we were and where we were going to. Other key things very early on were the development of a VCSE, Voluntary Sector Mental Health Alliance, and with that came the development of a recovery college, which was a new thing for Northumberland as well. A couple of other things, we did the work around those key pathways, and I have to say that the Community Complex Emotional Needs service that we developed, again a new service, has proved to be incredibly successful and is becoming very well recognised across the country as well. We've got a lot of interest in that. And we are the only area so far in the north that actually has a community complex emotional needs service in place, and it's doing some really good work. I suppose for me, just looking through some of the later areas of development are around our Safe Haven, the Bothy, which I'm going to be talking about, something about those multi-agency meetings that we've now developed. These are meetings that take place across the whole of Northumberland. All of our PCNs are involved, and it's an opportunity for organisations, all those organisations I talked about before, working together to look at an individual's needs from a sort of holistic approach, looking at all of those facets that an individual brings with them. So rather than being addressed in a kind of a siloed fashion, we've got organisations from across our system, including the voluntary sector, local authority, secondary care, primary care, bringing those complex cases to one place where they can be discussed. And following that, that individual is then supported by 1, 2 or 3 organisations at the same time. And that in itself means that that individual is not bouncing around a system, and we can see a person's needs in their entirety rather than in that siloed approach. It's been incredibly powerful so far, and there's again a lot of interest in the work that we're doing in Northumberland and how that approach can be spread across wider areas in the ICB. The Bothy I'm going to talk about a little bit later, as well as the Safe Haven. New things that are coming up are around, and I touched on this a little bit earlier, how we can work in a closer way with our communities and deliver services closer to home. We're currently, us within the local delivery team and all those system partners that I talked about, working together with the local authority and that Safer Resilience Communities team around how we can get our services out there and closer to our people in Northumberland, given the geographical challenges that we face here. One other last thing that we've developed in Northumberland is a trauma-informed care e-learning approach, which gives an awareness raising really about trauma-informed care, what it means, and some of those simple things that we can all do in an everyday kind of way to support people, not necessarily people with mental ill health, but just as we go about our day-to-day business, how we support other people and people that we either work with or we may come across. So that's a new piece of work, and we hope to have that launched sometime this year, this side of Christmas definitely. Okay. Not to labour the point, but I do like using this slide. I think for me, it really sums up community mental health transformation across Northumberland. It has always been everybody's business for us in Northumberland, and we've had incredibly good support, buy-in, commitment from all organisations across our system. That includes our ambulance service, our police force, our fire services in developing areas of this work. So not just health services, but much wider than that. and it's been an absolute pleasure, I have to say, pulling it together. And I think the commitment and enthusiasm that all of those people involved have shown have really helped to bring this on. I wanted to quickly talk about the Recovery College, and the reason for that is we set about our Recovery College being something that's available to everybody in Northumberland, all adults in Northumberland, not just those people with a mental illness. And the reason for that is because we're really keen on thinking about preventative approaches in Northumberland. We know that our population is it's an older population. Northumberland is a beautiful place to live. It attracts lots of people from across the country. We know that people do live in isolated settings. The communities can be quite isolated, and as we get older, we can become quite isolated as well. But that prevention model is really important. It's about people understanding their communities, understanding what's out there and available in their communities. And so our Recovery College has really been influential in developing groups, whether they be face-to-face or online. And there's a whole wealth of different things that are out there, and it's growing all of the time. It's about how we also link in with our grassroots voluntary sector organisations as well, and really start to kind of raise their profile in terms of what they do and the impact and outcomes that we can see from that. So I talked about those online sessions. They're really incredibly popular. And for some of them, you know, people are waiting for a short time in order to access them. And also, as I say, a variety of courses available too, and workshops. Now, there's a fantastic website for the Recovery College, and it does show all of the different community things that are happening across each of the areas across Northumberland. It's really well worth a look. The other one I wanted to talk about very quickly was the Northumberland Safe Haven, the Bothy. It has a physical presence in Ashington, very close to the High Street. Whilst it has a physical presence there, I'm really keen to advise that it's accessible for everybody across Northumberland. It was developed, the model was developed so that you know, people, regardless of where they are, can still access this service. So people can arrange for a virtual appointment, or they can also have a telephone appointment. It doesn't have to be a drop-in, although some people do like to attend the Bothy as a drop-in. It's a non-clinical environment. We're trying to make it as homely as possible, as welcoming as possible. It's a warm, friendly space. And whilst it's non-clinical, it does support people to regulate their emotion. It can really help people to consider some of those other factors in their lives that might be contributing to their mental ill health, and also support people to access some of those services that they may require going forwards. So it offers really good transport links across the county. As I say, it's refurbished to a very high standard, and it actually used to be a general practice, which means it kind of lended itself very well to being sort of redeveloped for a safe haven. The Bothy building also happens to house the Recovery College as well on the top floor, which means there's an opportunity for some really good interlinking and interaction between the two. So the Safe Haven opened on the 1st of April 2024. It's for anyone aged 18 and above, and it's about those people who identify as being in a mental health crisis or emotional distress in Northumberland. It's around those people who wouldn't meet the criteria for our secondary care crisis team services, but nonetheless require some support. So this is that community provision. It's open 365 days a year, and it's open 2 till 10 to try to mirror the busy times that our crisis team has. And I've talked about how we can access that as well. There's no referral necessary. People can literally drop in or ring or make a virtual appointment. So it's very accessible. It's proved to be very popular for men, actually. And for us, that's a fantastic thing to see, because we know that men generally don't look after their health, and certainly not their mental health. And knowing that it's a drop-in, I think it provides quite an opportunistic kind of approach to mental health. So that's it's a good thing to see. So these are important because, one, they're based in the community. As I've said, they're very easy to access. They're a safe space. They're very non-judgmental. They're not clinical. They can offer support and information, and they can also support people to access other services that will help them in their journey. And that's not about signposting, that's about actually supporting people to access these services. So those safe havens provide, they're very well integrated, I guess, within the community now. And they're doing some really good stuff with the wider health and social care kind of partners. And I think I talked a little bit about those sort of those other social aspects of our lives that can impact our mental health. And the Bothy can support people with those and also link them into services that can provide a bit more specialist support as well. So I think, I don't know how I've managed that, but just about time for some questions.
Thank you very much, Jane. It was spot on, just 20 minutes. Thank you very much. And are there any questions, suggestions, appreciations for Jane? Yes, please, Alan. Yeah.
Thank you, Chair. Thank you for that presentation there. To be honest, I can't help but feel that the thrust of your argument, this service provision, is geared towards people at the mild end of the spectrum of mental disorder, people who present with anxiety states, low self-esteem, etc. And are willing to talk with and engage and say, oh, I feel this way, will someone talk to me about it? What I'm not getting, and I stand to be corrected on this, is a lack of provision for people towards a complex, treatment-resistive end of the spectrum, the very complex needs, who don't engage, who are insightless, psychopathic disorder, people who are in a phase, people who are in a manic phase, for instance, feel there's nothing wrong with them, feel euphoric, they feel brilliant, they love the way they're feeling. But for the families and the communities who haven't coped with that, it's hellish. And all of this, no disrespect, but it's geared towards talk about how you feel, not about people with frank psychotic delusional symptoms, Valdo, Calicade and people like that.
Yeah, I understand that. In answer, there are a number of different bits to your question there, so I'm going to try to break them up a little bit. And I think you're right. I think often people can find themselves when they experience mental ill health, or they're supporting people with mental ill health, feeling very isolated and not knowing where to go or where to turn to. I think part of the principles around transformation is that no wrong door, and that whoever you talk to, the aim is that if someone raises their concern, issue, whatever it is over here, that it will get to the right place in Northumberland. It's very early days. For instance, we've provided some additional funding to help our carer support in Northumberland, specifically for carers of those people with severe mental illness. So that funding came about just recently in this financial year. It's only just been released. So we're hoping to see a real improvement in the way that we interact with some of those people, carers, who are finding themselves holding what can be an incredibly stressful, difficult, frightening kind of thing. Absolutely, I absolutely acknowledge that. In terms of our secondary care services, and we've got secondary care here, we know that there's a growing demand. But for those people with very complex needs, clearly our primary care services are well linked into secondary care. Things like the Bothy, whilst they're in the community and they're non-clinical, anyone with a mental ill health issue coming through to them will be signposted to the right place, supported to go to the right place. So for something like the Bothy, they link into our secondary care services, so they have good relationships with the teams that Laura, for instance, manages, to literally pick the phone up and say, we have someone here actually who needs a bit more support, and that person will be physically supported to get to the help that they need. So I appreciate that when we talk about transformation on a very high level, it is difficult to see actually how that translates on the ground and for some of those kind of more complex needs. I don't know, Laura, if you want to come in and mention anything more about those individuals.
Thank you, Jane. I think 2 points as perhaps the opposite ends of this continuum, really. So building on what you're saying, Jane, obviously the work that you've talked about, things like the Bothy, the multi-agency meetings, are providing that wider front door, I suppose, that increased access, that opportunity for anybody, be it the person who's experiencing poor mental health themselves or their families, friends, carers, to have more ways of being able to say, I'm really worried, I need help, and for that to much more swiftly get to the most appropriate and most helpful service. So it opens the door at that end. On the other end, that really complex and needing to kind of wrap lots of services around somebody and offer that very structured treatment for somebody. We are regionally and locally looking at developing our assertive and intensive community mental health care, specifically following the Valdo Calacane inquiry and all the lessons that have been learned nationally from that. So within Northumberland, CNTW and Adult Social Care have been working very closely to develop much more integrated local teams to be able to offer that very flexible and responsive service to people who need that much more assertive input in the community. So our hope, I suppose, is that by increasing access and people finding it much easier to say, I'm worried, or there's something not right here, we need help, and having much more robust and flexible services at the complex end, that we'll actually be able to get that really kind of integrated and responsive service across all areas of mental health need.
Thank you. And it's about how we bring that together, isn't it?
Yeah. So my understanding is that, Jane, the objective is to pull various organizations together so that we collectively achieve more than what each individual can independently achieve. That appears to be the one point. And I think in that regard, fire service has been playing a role in that one as well. And the second objective appears to be making it available to everyone, signposting them instead of, complex cases cannot be dealt with, can only be dealt with professionals, So signposting them to where things needed, right? Any more follow-up questions? Sorry, you want to come and then come in.
Yeah, thanks very much, Jane. It's great to see that written so clearly about all of the changes that have happened over the 5 years. And you talked about 5 years ago embarking on this transformation. And it does strike me that things are tangibly very different now after the 5 years, and particularly for the resident journey. And them, not having to be put around different services, but having that single place and it being a smoother way for them to get the support they need. I did wonder what the plans are ahead, because you've come to this point 5 years in and there's been a lot of change, but what's the future of mental health transformation?
That's a really good question. I think for us, and transformation, and certainly in terms of the monies that we're seeing coming down centrally, we know that our long-term plan, unfortunately and sadly, mental health doesn't seem to feature particularly highly on the agenda. There are some key areas of work that have come through, particularly around children's services and the development of mental health support teams, for instance, and 100% coverage, across the country. In terms of the community mental health transformation, as Laura said, we've seen a lot of work going on nationally around our inpatient services. There's an inpatient quality transformation, for instance, that's happening at the moment. And for me, it almost feels like the emergence of the neighbourhood working is kind of going to be the next area of work that I really hope our community mental health transformation will be seen as a platform, a springboard, and an opportunity to really learn from the work that's been that's taken place around community mental health transformation. So that the next step, I think, for me is that neighbourhood working starting, for there to be recognition and cognizance of the work that's happened in mental health, and to be able to bring physical health and mental health much closer together through that collaborative work. And that's where I really hope to see the next steps around this transformation. Because I think bringing physical health and mental health together in a meaningful way is really what needs to happen. There's still significant lack of parity for me between the two, and we know the one goes hand in hand with the other.
Thank you. Kevin, you wanted to come in?
Yeah, no, thank you, Chair. Thank you very much for your presentation, Jane. I just wanted to say how brilliant the Bothy has been from a policing perspective. I went to visit the Bothy last summer, and what I saw there was a brilliant team of staff, really engaging, and the environment is exactly as you describe. I felt really comfortable there. I know the neighbourhood police team are there regularly, and you highlighted men in particular, particularly men we come across with substance misuse. And what we were lacking previously was they're not quite in that crisis where they need your secondary teams, but where else can we refer them to? And that's been making a huge difference. So it's just a comment really to say thank you very much, and it's making a difference in Northumberland.
Yes. Thank you very much, Kevin. You wanted to? No, sorry. Okay. Yes, Neil.
Thank you, Chair. I mean, a recognition from my side, Jane, I know a huge amount of work and effort's gone into the development programme over the last 5 or 6 years, and I think we've leapt forward a country mile. I think a particular recognition as well of CNTW, actually, and I've noticed a real change in the last 3 years, and I don't often name individuals, but I think since Chloe Mann has come in, the relationship we've had with CNTW has just improved tenfold, and we seem to be knocking doors out of windows now in terms of service development. I know you're closely involved in that as well. I just wonder, as a question, is there any metrics starting to show? Because it would be really nice to see the value coming through in metrics, you know, number of referrals through to GPs on mental health related issues, acute inpatient admissions, etc. It would be lovely to see a little suite of that, to see it. The world's changing, you know, and I think potentially we have a less resilient world as well, which means we can have growing problems with mental health issues in that environment. So it is a difficult metric to try and balance, but it feels to me like we must be getting benefit. I mean, the Bothy is one example, but the other programmes you've got are phenomenal that we've put in place to try and avoid people getting to that very acute need, and the sort of family breakdowns that we're talking about in the other question, things like that.
Yes, thank you. Brilliant question. And ordinarily, I would have brought a lot more detail with me here today, but yes, absolutely, understanding outcomes and impact is really important in all of this work. And I mean, as you'll be aware, all of these services are commissioned by us, so of course just through that normal contracting, monitoring, evaluation kind of process, all of that happens. So certainly we gather and we work very closely with providers to understand quite what these services are doing, how they're working, why they're working in the way that they do, whether we need any further tweaks. So all of that is absolutely happening. And at the same time, what we're trying to do with this transformation is understand the wider impacts as well, and to understand where the value for money is, where that's coming from. So just as a very brief example, because I'm aware of the time, we're working at the moment with the Bothy around understanding, because this is a service that's very integrated into not just the community, but also in terms of how it links with lots of different organisations and services. So we've embarked on a piece of work to understand what that means for our system. So for those people who go to the Bothy and they haven't needed to access the crisis team, for instance, what does that mean for that individual in terms of their own personal outcome? What does it mean in terms of their experience of the service? What does it also mean for our wider system? So how have we benefited as a system from that? And that could be financial, it could be in terms of appropriate use of resource, appropriate use of services as well. So we're working with a number of partners across our system, including the local authority and our secondary care providers, which, to be honest, that's where there's, you know, we've got a significant spend to understand the real benefits of these sorts of services in the community. So I'd be really delighted to come back and talk more about that when we're a little bit further down the line. It's the Bothy's only been around for what, a year and a half. It took a while for it to bed in, and it wouldn't have been sensible for us to have started that work from the get-go. Obviously, all those other metrics have been collected and are being reported on. And as I say, I can bring those to you at another stage when I've got a bit more time. But that wider impact work has started now, so it'd be really good to understand how that looks.
Thank you. Abby, you want to go?
It was just to follow on from Neil's point. I agree with what everybody else has said, you know, in terms of the great work. I think it would just be really useful to sort of hear from that the Bothy in terms of, you know, that there's the keeping people out of kind of crisis, but then there's also the impact on the community services in terms of if you're referring people out to alternative services, how is that looking? What impact is that then having on those services as well? And kind of how do we collectively work better together in terms of that wider inequalities piece that we're all working towards? It would just be really, really useful to then be, because then in the room we'll all be able to, you know, to think how we could do it better and different.
Thank you. Any other questions? I have one suggestion, actually. In fact, I was very impressed with this online sessions you've got. I mean, guided imagery and everything, because I work with the student population, you know, university level student population. Often they go through, they are on the lower end of health crisis more often, not all of them. There are some serious cases. So, you know, that would be you know, there are lots of students who live in Blythe and Ashington because the rent is cheap compared to Newcastle. So I actually went through your online session. I wanted to see how the online session works, but suddenly I got stuck because it's asking all the details about GP. Who am I registered with? I didn't understand the purpose of why a person who's watching online session should be fulfilling all those things, because it says very clearly it's online. You know, if you're going through a tough time, just watch this. That's a very fantastic idea, but I think it should be made easily available to all people. They can come and see. And you can also put a small software nowadays, how many people are visiting the site. It automatically counts. That will count as a metric, you know, at the end of the year or 6 months, it will give you how many people visited the site. So it would be very good to accommodate these things. Yeah. It's a mild suggestion.
It's fine.
It's not a criticism.
Just very quickly. So the reason we asked people for their GP is really just for us to understand where they are in Northumberland. And the idea around that is we want to ensure that the provision is as equal as possible across the whole of Northumberland, understanding that each of the communities are very different, each of our different areas and need is different. However, it's just about understanding where the gaps are and, you know, and what we can do to support that. However, just recently, I have been working with the Recovery College to think about, can we ask people for a postcode and just the beginning of a postcode so that we can do it in that way rather than you know, using a GP address.
Yeah.
So
because
that was,
you see, most of the students when they come in the first year, they register with the GP in Newcastle. They live in Newcastle. And then they slowly find the area out, so they look at Blythe and other areas very cheap. Yes. So they may have GP in Newcastle, but they may be very much living in Northumberland.
And that doesn't matter. So if you're resident in Northumberland, regardless of where your GP is, you still have access to all of these things. But it could be misleading. I appreciate that.
They might see it, they might think they can't.
I appreciate that.
Thank you. All right. So we will now move on to the second item on mental health. I think just a brief introduction. we are supposed to provide, we being this board, provide mental health strategy by April 2026. Now this is being developed and we are going to get an update from Yuan.
Well, thank you for inviting me. I hope you can hear me okay. Just wait for the slides to come up. Okay, so obviously I introduced myself earlier on. I'm Public Health Manager working on public mental health and suicide prevention. So today, this is just to give you an update on the development of a public mental health strategy. I wanted to start off first of all by just describing what is public mental health, because I'm not going to assume that everybody knows what that is. So public mental health addresses whole populations. It's an approach focused on improving the mental health and well-being of whole communities through prevention, education and supportive environments. It's not usually focused on clinical interventions and treatment of individuals. It's about providing communities with good quality information to support their own mental health and emotional well-being, but it's also to help them understand who and when to go to get that help when they need greater help and support. This is just a little bit of a diagram just to describe mental health and sort of the overlapping features around mental health promotion, mental illness prevention, and then mental health treatment, recovery and rehabilitation. And just a little bit about risk and protective factors, which can be divided into separate things, so individual things, family, and then community and structural level. And obviously when we're talking about risk and protective factors, risk factors can obviously increase poor mental health, and protective factors would obviously promote and influence positive mental health and overall well-being. Just a little bit about the current position in Northumberland. I just wanted to describe here about some of the other strategies we already have in place in Northumberland, and just note the one that I've missed out there, which is our joint health and wellbeing strategy. So apologies for that. It's not an exhaustive list. It's just to describe some of the other strategies we have in place, which may link, well, do link with public mental health and mental health in general. So we do in Northumberland have a separate suicide prevention strategy, which we will be looking to refresh next year. There's a dementia strategy, I know that came here recently, which is a 10-year plan. We have our inequalities plan. We've got an all-age autism strategy. There was our recent DPH report, which was focused on physical activity. We've just talked about the importance of that, of the two coming together. There's a suicide prevention toolkit for autistic people, and then separately we have a children and young people's emotional health, well-being, mental health strategy, which we'll also be looking to refresh. Just a little bit about some of the partnerships we have in Northumberland. I'm talking about these from an adult focused perspective because the strategy that we're developing is adult focused. So we've got a number of groups in Northumberland that work in partnership together. So we have a strategic group which meets quarterly, which is chaired by our public health colleagues, another colleague of mine. There's a mental health steering group, which is actually chaired by myself, which actually meets bi-monthly. Historically, that group used to meet quarterly as well, but during COVID and lockdown, I actually moved that to bi-monthly meetings, and I've actually kept those as bi-monthly meetings because I think it's important for us to meet that frequently, if that makes sense. We've got our Community Mental Health Transformation Leadership Group, which is chaired by the voluntary sector, Mental Health Matters, and supported and led by the ICB. And then we have our Safe Haven Steering Group, the Bothy, which is chaired and led by the ICP, and I'm obviously involved in those as well. And as I said, there's the Northumberland Joint Health and Wellbeing Strategy, which is really important as well to link with. Just want to talk about children and young people's mental health. There is a children and young people's mental health group that is chaired by the ICB, which has recently been reinvigorated and has met a couple of times. Yeah. And then there is a strategy, which, as I alluded to before, is due for a refresh as well. So this is why, when I'm talking about the strategy we're developing, it is adult focused, but obviously has to link really closely with the children and young people's strategy. I just wanted to put this slide up to talk about the importance of partnership working, and as Jane has already said in her presentation, we have really good partnership working going on in Northumberland. So this slide is just to demonstrate some of the organisations, the services that we have in Northumberland. I shared this slide at a workshop that we had recently, just to demonstrate, you know, the vast range of things we do have in Northumberland, and it is really important, this partnership work. A little bit about our asset-based working and our strengths in Northumberland. I'll talk about this a little bit later on in my presentation, if that's okay. A little bit about the focus and aims of the strategy. So we've tried to sit down with various colleagues to try and think about this in a structured way. So when we're talking about well-being across communities, we're talking about universal preventative approaches. Obviously, a public mental health strategy is around prevention. It's about self-help, how well are our residents. If we're looking at preventing mental illness, it's about addressing risk factors. Do we have data? Do we understand these in Northumberland? Talking about early intervention, so things like support, pathways, connections, and then recovery, about integration back into society. If you have had a mental illness or you still have a mental illness, how do you integrate back into society? And then obviously inequalities, disparities, things like mental health services, what's available, social determinants, things like rurality in Northumberland and deprivation. So the scope of the strategy, as I've said, will be adult focused. It'll be based on robust evidence, whether that's local, national or international, demonstrating local need informed by data and intelligence, which isn't necessarily easy to get, identifying gaps in data and intelligence, and where we need increased focus on data capture. We need to identify and increase the use of the local assets that we have, and keeping resident voice central to the work, along with stakeholder and community feedback, and obviously promoting stronger partnership working, holistic approach, etc. Just to say, when we're talking about data and intelligence, there is actually alongside this, a colleague of mine within the public health team is actually doing a mental health needs assessment as well, so that'll help to factor in to the development of the strategy. So we held a workshop in September where we invited numerous stakeholders, and we had a really productive afternoon at this workshop. So there was three main things that we asked those in attendance, you know, things like what preventative action can we take at a local level, what inequalities do people in Northumberland experience, and looking at our assets and approaches, what's strong, what could be stronger, are there any gaps? From that workshop, we had 3 30-minute really meaty conversations to try and look at those questions. And myself and colleagues have been looking through the feedback that we've gotten from that workshop. There's a lot of information in there. So I've just got 2 slides just to kind of give you a little brief overview of some of the themes that have been coming out. So some of the things that I've picked up on is actually about the good online mental health support available. People do appreciate that. Something around there needs to be better use of local assets and facilities. What facilities have we got there? Are we using them to their maximum impact? We do have good networks. There's lots of good community-based organisations out there. So, for example, that's just one example, things that are supporting our veterans. There is a gap in data. Data comes up over and over again. How can we connect data? How can we share data better? And then somebody talked about it earlier on about building resilience. We need to build resilience, self-help, and empowerment. And then a little bit around support, early intervention, supporting recovery and reducing inequalities. And I know that's So reducing inequalities is very important to this board. So better support needed for parents, better support needed for carers. That came out really, really strongly. I mean, we've talked there about carers of those who are caring for people with a mental health illness, but actually just better support for carers generally, a need for cross-generational work, a better understanding and awareness of support and services needed, so the public understands what's out there for them, but actually professionals as well. So professionals sometimes might hear about something that's available, but then they may forget about it. It's about reinforcing and reminding people what's actually out there. So that came out for public and professionals. Ensuring services and activities are accessible, for example, for older people. And something around hidden mental health need. So I've been doing some work with rural communities and farming communities, and a little bit around, you know, the stigma of mental health, and just making it easier to talk about your mental health, and being able to feel like you can go and ask for some help and support. As part of the development of the strategy, we've put out a community survey that is out until the 28th of November, so I'm imagining we'll get quite good feedback on that. Next steps for the strategy. So we're going to continue to collate the feedback from the workshop. We're seeking views from the residents through the community survey. We're going to identify the key themes, update the Health and Wellbeing Board. I'm here today. We're going to work with a small steering group to shape priorities. We're going to develop a draft strategy and we'll share for feedback. We're hoping that the strategy will be completed early 2026, and then we're going to come back here. I'm not sure if it's March or April, but we'll clarify when that is, and then we'll develop an action plan to deliver the strategy priorities. And I think that was it from me. I'm open to taking any questions.
Thank you,
Not
Yvonne.
difficult
Thank
ones.
you. It's a real good update on what is going to come soon. Are there questions? Yes, please, Andri.
Thank you, Yvonne. That was really good. So you would expect me to talk about children. So if I think back and link to Best Start in Life and our key priority, particularly around inequalities, absolutely spot on around some of those emerging themes. So it's great to focus on Best Start in Life and doing things so much earlier with children, but actually children have parents, carers, wider family networks, grandparents who do so much more of the caring, and I can see the link directly in with some of the work. So I wanted to ask whether I could be cheeky and ask for another addition in your next step, and could we link in with the integrated family hub work around Test, Learn and Grow? That's probably something we're going to come back and talk about here at Health and Wellbeing Board, but we have an opportunity through Cabinet Office to reshape what our family hubs look like moving forward. You picked out one of the areas as an emerging theme is data, and that looks like it's going to be one of our key work streams for the future. So I do think there's your challenges and emerging themes are the same as our family hubs, same as Best Start in Life. So for me, let's do it once and do it together. So just a few extra words around how we could link in and make sure we link with those developments, so that we're only developing it once in the same room together. But thank you, really good.
That's a very good point, actually. That's well taken. Yeah, we will take it on board. Yeah. Yes, please, Terry.
Thank you. Thank you for that, Yvonne. And obviously we've been involved in various aspects of this, so it was really good to see it all now coming together. I was really pleased to see the emphasis about public involvement and community involvement in it, and I just wondered if you've got any thoughts about how that will continue once the strategy is actually in place, because I don't think it's the survey now shaping, it's how it then is embedded within the strategy and the delivery of the strategy. So any thoughts you've got around that, obviously, and obviously, you know, we're very happy to be involved in that as well. But I think the other point as well is that because it is a strategy, and I think you were very clear at the beginning about the preventative nature, it's about community level, it's not about individual level. I think what we always hear, and it links back to Jane's presentation very clearly, is how will people see the link between the ambitions of the strategy and what is then actually delivered on the ground, and what are the mechanisms going to be for that, so people can see, I suppose, see the point of actually responding to the survey. How will they know it's going to make a difference in the end?
Yes, I think you're absolutely right. We need to think about how we're going to do that, and maybe I haven't actually thought about that yet. So I know there's been conversations within the public health team just generally around how we do this better. So I think, yes, you're right, as we develop the strategy and try to put things in place is how we're going to actually, yes, include residents, communities in knowing that, well, actually, this is what we've done. So I think, yes, that absolutely needs to we need to think about that more closely, and we will do.
Thank you, Chair. Thanks, Yvonne. As a layman, can you give me some tips on how to prevent a mental illness? Because it mentions prevention a lot, and I want to know what I can do to prevent it. Not in myself, but in others.
I can't necessarily say how you would prevent a mental illness, but I can talk about how you can maybe build resilience and kind of hopefully improve your mental well-being and your physical well-being. I mean, one of the things, and you know, we can't prevent all mental illness. It's just not possible. But if we can build resilience and try and get people into a good place so that they feel that they can support their mental well-being, and we can all support each other. I mean, one of the quite simple things that we talk about when we talk about mental well-being is about the 5 ways to well-being, those things, those positive things that people can hopefully do to try and improve their own well-being, things like connecting with others. I should know these off the top of my head. Actually looking after physical activity, being physically active. There's a whole range of things that people can do. But actually, it is also around what support is out there for people and what is that early intervention and where can people go if they're struggling. We can't stop all mental illness. We just can't. But we can. There's a lot of things we can do to try and alleviate that and try. There's a lot of people out there who are struggling, but actually we could, if we did more preventative things for them, maybe. I mean, your mental well-being is so what's the word? Dependent on things in your community. Have you got a job? Have you got have you got a warm home? Are you eating healthily? It's all those things that, which is why to do this, we need everybody to be helping with this. We're not going to do it with one strategy, but it's something to bring together to see these are the things that we're looking at.
Oh, sorry. Yes, Jane. Yeah.
Thank you. I just wanted to quickly come in. That's such a difficult question to answer, actually, because we all have different coping strategies. Life's difficult. Life can be really hard, and we all have different thresholds as individuals. For me, I think it's just really important, and I think I talked a little bit about sort of that trauma-informed care approach, and that sounds really clinical and horrible, but it's really about, how as a society, as individuals, can we be kinder to each other, and and how do we ensure that if we can sense that somebody is struggling, it might be a colleague you work with who's having a bit of a bad day, it's about how do we say, actually, are you all right? Do you want to talk about anything? And that sounds really basic, but actually, if those sorts of things can really make a difference to somebody, and it can be the difference between feeling, I can't do this, I'm worthless, and it kind of contributes to a low self-esteem. All those sorts of things can gradually build up to create mental ill health. And so I suppose for me, we all have a responsibility to help prevent mental ill health, but it's never going to go away. It's always going to be with us. It's just about how we, as individuals and as groups, communities, society, help to make mental health less of a stigma, for us all to be a little bit more aware, to not feel frightened by mental ill health, although I appreciate it can be scary sometimes, and to, you know, kind of generally think about it in a different context. And so for me, well done. I think a difficult question, Yvonne, but I think you're absolutely right. There are some of those very early kind of level things that we can all do to support ourselves. I think be kinder to each other is probably a good start.
To yourself.
Yeah, I just wanted to come in and thank Yvonne for a really clear presentation of how you're approaching developing the strategy. I think it's quite a significant piece of, very innovative piece of work. We haven't had a public mental health strategy before, and I think it's quite a new thing really across the country as a whole to be doing these strategies locally. I know our joint health and wellbeing strategy, we make the commitment to take a whole systems approach to mental health. And the things we've heard from Jane and the other strategies that have been mentioned that link in, I think this is an important part of the picture to focus on building, boosting and protecting people's mental health and looking at the conditions that shape people's mental health and the interventions that we can do at that early stage. So I just wanted to come in and give that reinforcement. I know that many partners have been involved in the workshop, and many of you here will continue to play a part in shaping the strategy, and I think that will make it the best it can be when everyone's playing their parts, and really look forward to seeing how this develops and turns out. So thank you.
So one final question. I'm sure you know, every council will be developing mental health strategy, mental health well-being strategy as well. How are we comparing, or do we know what others are doing? Where are we with respect to other councils? I know it's a nationwide initiative, so is there anything? Sorry if I caught you off guard, you can tell me. Yeah.
That's okay. I don't know whether, Yvonne, whether you've looked at other areas. And
yeah, before we started on our strategy, we have looked at other strategies, and some of them are different. Some people want to focus on certain, you know, but there's generally a bit of a common thread going through them. Yes, that, yeah. yes. But there are a lot of other strategies out there.
The reason I'm asking is there anything specific to Northumberland we need to address, or Abby?
I think that comes back to that metrics point in terms of what is it we're trying to achieve. I think is that what you mean, Paul, in terms of like where are we now, and then if we put a strategy in place for next year, what are the outcomes going to be? And that will differ in each locality because every local authority will have different challenges.
That's what I'm alluding to. Thank you. Yeah. Yes, Alan.
Just one last point. You kind of touched on it before, and it's also mentioned in one of your presentations here. Just try and be aware of the fact that there are some mental disorders we cannot cure, we cannot affect, and needs to be acknowledged. And I think there's sometimes a very simplistic approach in mental health. Meet that person's needs, tick the box, risk assessment, tick the box. We're not miracle workers in this job. We can't feed 5,000 people with 2 fish and a bunch of loaves. Be realistic in your expectations. And I think as well that sometimes there's for all they might say it's not, there is still a blame culture in this job. Something goes wrong, blame whoever was allocated that person. Was the care plan up to speed? We've all seen this with CQC and recent tragic cases in the press about suicides. I had 3 of them in a row down in Teesside, etc. But it needs to be acknowledged, the complexity and the intransigence of some mental disorders, and the mental health professionals aren't miracle workers. And don't blame people for not being able to cure everybody that comes across your... No psychiatrist in the world will say, I'll cure this person. Be realistic and accept that, you know, what you can do is limited. Try your best, but you're not going to get it every time.
That's right. It's to do with medicine as a whole, isn't it? I mean, doctors are not miracle workers either. Thank you very much. So now let's... mental health to some advisory side of things. The next presentation will be from Abby on the works they are doing on Citizens Advice Bureau. I think we have, well, from my experience, Citizens Advice Bureau has been working very efficiently in the past 2 years, I have seen. And also, I would like to remind the councillor, if you have some complex cases, you can refer your residents to Citizens Advice Bureau as well. Yes. Thank you. Yours, floor is yours, Abhi. Yeah.
Thank you very much, and thank you very much for having us. It's quite timely. This is an impact report for 24 to 25. We've got our AGM coming up. For those who haven't, you should all. It's on the 1st of December if anybody wants to come. And it's also timely because we're about to be recommissioned in terms of the service, and we are always open to feedback and how we can do things better, reach more people and work more collaboratively. Every year, thousands of people come to us to help us to solve their problems. We try and tailor the approach that we take, but in 24-25 we supported 59,433 clients. Now of those, there was 28,903 from Northumberland and 17,838 unique clients, because people do come back to us. The reason why those numbers are different is we do operate a couple of national contracts through our National Citizens Advice. And it's about, that's part of our resilience strategy and a part of our, but I'm just trying to explain why there's slightly different numbers there. Because Luke manages this contract and he might be going, 59,000, that's not what you normally tell me. So I'm just trying to give that context. But within those 17,000 unique clients, there's 19,000 cases. And the reason why we distinguish between clients and cases is some people might just want one-off discrete advice. They might understand, they might need help filling a form in, but other people have very complex cases that require a significant amount of casework. It might be debt, it might be problems with landlords or problems with poor homes or family issues. So it's just about giving a bit of context to it. There was 137 staff, and we're delighted that we have over 75 volunteers. This is the culmination of the most significant categories that we help people with, the detailed issues that people bring to us. And as you can see, debt is a significantly high number. That's partly down to the fact that we have a national debt contact centre out of Ashington, but it is still always one of the top 2 or 3 issues that we have locally. Benefits, tax credits, benefits around universal credit, and over the last few years, certainly since the cost of living crisis and the energy crisis, the amount of energy-related and utility-related issues has gone through the roof, as well as consumer goods and services. I think it's about, it's important to understand the problems people face, and as a key partner and contributor to the Northumberland Inequalities Plan, how we're producing that proactive action to support meaningful change for people around some of those areas, around the pinnacle of reducing inequalities, around jobs, good education and high quality housing. I mean, the statistics are great to say, yeah, 91% of people say we've helped them find a way forward. There's a reason the other 99%. Some people have really complex issues that we actually can't move that on, you know, or rather when they're asked this question, it's still ongoing, often with DWP, if it's a benefits issue and things like that. But it's really about the wider impact, I think, of advice in terms of helping people to solve a real problem and helping people to build that resilience that we've just been talking about around people's mental health and around people's well-being. If you can actually address the problems that you're facing yourself, that helps you to be able to live the complicated and sometimes difficult lives that we have. The client feedback is really positive, and we do report on that, and we can give more detail, which we report through our contract management around actually what clients feel about access to services as well as the outcome of them. But it is really about dealing with the complexity of public services and how to navigate them. Again, these are some top level value figures. So in terms of savings to the public purse, we've helped people to bring in £17 million of additional income for the local economy. And that's constituted of annualised benefits awards, one-off grants, reductions in bills or where they've been unfairly charged, where we've been able to get those removed. And that, in addition, there's over £8 million of debt that people had that we've managed to write off because they're unable to pay. Obviously, it's important that people pay their debts, but where their income and is less than their outgoings and people are in a deficit budget, we're increasingly seeing more and more of that where people don't have the levers to be able to pull. So that's about £25 million in people's pockets in Northumberland to help spend in the local economy. But the charity's impact is much more than just its impact on the individuals that we support. You know, in terms of reducing costs to the public purse from tackling that poverty and social exclusion and disadvantage, we have twin aims at Citizens Advice. The first is to help people with the problems that they have, and the second is to try and do something about those problems in the first place. It's about trying to change those systemic issues that keep people coming back. We don't want people to come back. This is the one thing, you know, we don't want repeat customers. Actually, we would rather people had that issue solved. And then strengthening those local economies by bringing in funding. You know, the reason why we have those national contacts is to be able to offset some of the cost of the organisation. So it's all about building that resilience to do more, as well as promoting social wellbeing through working with everybody else. And part of that is me being part of this board, as well as, you know, being part of all of the other groups that we've talked around health and wellbeing. It's hard working in partnership, and it's difficult and it's time consuming, but it's really the only way that we can all achieve the shared ambitions and the shared goals around reducing inequalities. And then also supporting skills, you know, through a range of employment and volunteering opportunities. The volunteers that we have, some of them are part of as an actual employment route way to try, and we've reached into communities that are underserved and trying to give an opportunity to come and work with us, and then hopefully for us as well as people who are retired and have a great deal of skills and assets. And we're very glad to receive any volunteers in any shape or form. Citizens Advice has a Treasury approved cost calculator that was done by New Economy, and it calculates the savings to the public purse for the impact of the advice that we give. And in terms of when people approach us where they've got a problem with an employer, they've got an issue around either being expected to do something, or there's a problem where they don't have a contract, it extrapolates that we've managed to save 3.8 million by keeping people in that job and keeping people in work who maybe were struggling because of lower level mental health issues or because of the debts and things like that. In terms of preventing evictions, there's £13.5 million there. Preventing homelessness, you know, housing evictions, and in terms of that, you're needing further mental health services. So as you can see, I mean, I don't think this came out in the pack, but obviously you can have it all afterwards. You can have a look at these, and if you've got any questions, and I'll quite happily take you through the cost calculator model to the best of my knowledge. I have given it to cleverer people than me, and Pam, for example, within the public health data team, has interrogated and understands how this all kind of works out. But in short order, in terms of for every £1 that's invested in us, you know, there's £6.28 in fiscal value, but then in terms of that public value and in terms of the value to the people we help, we think we're doing a decent job. But of course we can always do better, but that's, you know, that's what keeps us going and keeps us trying to do more, is trying to make sure that for every, and why we try and make sure that as much of any money that comes in goes directly to the front line to help more people. I just touched on before volunteers. We wouldn't have a service without our volunteers. It is a bedrock of community of our community service within Citizens Advice. Our volunteers are highly trained, highly intelligent, and highly skilled, and they can do very much a lot of the different jobs. They see clients, they do advice, they do interviews, they do that complicated welfare benefits form filling, as well as taking part of as our research and campaigns, and of course our trustees. Not to forget the trustees, who are all volunteers as well. This is from our dashboard, which we have a county council specific dashboard which just looks at Northumberland, and it shows the left-hand side map is a sort of zoomed in of the southeast corner, because as you see on the right-hand side of the map, it's just a big red blob. That counts for individual clients and interactions. So what you can see is that it's reflective of the general population of Northumberland. We have that concentration in the southeast. but actually we have full county coverage. We do reach people in all areas of Northumberland. It won't surprise you to hear that the top 5 wards of people who need our services is Hurst, Croft, College, Ashington Central and Alnwick. Sometimes they change and they fluctuate in terms of being in the top 5. And actually, what's quite interesting when you look at the demographic, they're quite similar in terms of numbers. It's not sort of like, you know, a huge 10%, say, for example, came from Hurst. It doesn't work like that. But it isn't a surprise, I suppose, that some of our more deprived areas do require our services more. Here's a little graph for you just to show you the last 3 years. Yellow is in terms of unique clients, because that's the way our system records them. So if someone comes back to us 3 times in a year, that number there will just count them as 1. You know, sometimes people come, we do have people that bring all of their letters in to show us because they can't meet them. That will still only count them as 1 person in that time period. And then the blue graph shows the number of interactions that we're actually having with people. And what it does is illustrate the complexity of the clients that we're supporting. And it highlights the importance, I think, of a lot of the work that we're trying to do, which is around early intervention. Because the earlier we can get to people, the less complicated they are, the fewer issues. At the moment, the number of interactions per client is 6.2, and every client has an average of 5 different issues. This is just a little bit of a dashboard in terms of the way that the clients are made up. It's quite difficult for you to see, I appreciate, but you'll be able to see it when you get the pack later on. There's a majority of our clients, and that majority hovers between 55 and 65% each year, that are long-term health conditions or disabled. It's not surprising if you think about the welfare benefit system and people who are coming to us about financial issues, but it is just worth knowing that that is a majority of the clients that we get. Quite similar, quite a good gender split, which I'm also quite pleased about, because, as you know, mentioned before, sometimes men struggle to come forward when they have problems, but actually, you know, we do support almost 50-50, 55-45. And from an ethnicity perspective, I'll help you out, because that white English is 80%. When you add Northern Irish, Irish, Welsh and Scottish, it gets to 90%. So we're still about 90% of that, you know, that sort of white Indigenous population. But actually, we are reaching communities of other faiths and other colours and in Northumberland beyond that of the census. So I think that also shows that we're quite inclusive. These are just some of the projects that we completed this year. Multiply, for example, was around helping people with budgeting. So we were doing sort of financial resilience with people in groups. It was a NECA-funded project. I mentioned before about volunteering. The Inclusive Economies Communities in Place, that was about reaching into communities around the southeast and around, you know, the Hurst and Ashington, trying to generate volunteer routeway opportunities for people to come through to then be employed. We've expanded our reach through things like the welfare advice services and GP surgeries, and at welfare support, the school gates, looking at families, looking at where people are going actually to the school gates, actually into GP surgeries, into health and clinical settings, rather than expecting people to come to us. And that's certainly the direction of travel that we've been on over the last few years. And I think it also aligns very much with that collaborative cross-sector and cross-organisational working that we hear about every month here. I couldn't come here and talk and not mention Thriving Together, just in terms of Thriving Together is the Northumberland's commissioned VCSE support service. Citizens Advice Northumberland is the contract holder, and therefore we have strategic governance of Thriving Together. And we support that through representation here and elsewhere. Some of the highlights of Thriving Together in 2024 and 5 are included there for you to see. But we're very proud to share the impact that they have, which we feel, for a very small team with relatively low investment, significantly outweighs and punches well above its weight. And it also is critical to the landscape of the County Council and all partners in terms of that inequalities work. Clients are what we all do it for, aren't we? At the end of the day, these are just a couple of comments. I mentioned I was preparing for our AGM. We've got some client videos that we're showing, and you know, it always touches me when we hear from clients in terms of the difference it makes. And sometimes that can be quite simple, and sometimes it can be life-changing. But you know, like I say, we get really positive feedback, and where we do get anything that's not right, we're able to hone in and challenge and look at where it particularly is, so we can address things in the moment. The research and campaigns piece is central to our second aim that I mentioned earlier on. We all use a combined system called Casebook. All citizens advice around the country use it, and all of our advisors submit. If they see something happening and they think that that's a little bit off, it might be about rogue landlords, it might be about scams and things like that, we raise evidence forms which go centrally, which is how nationally citizens advice are able to act in their super complainer status for various different things around energy or around postal services. But it's really important, and we really promote how important it is for us to be providing that evidence, because we've talked about data, a couple of times, and data is a central theme, I know, to you, Audrey, and to you, to Neil. But it's only if we use the data that we have to better effect is how we're actually going to change anything in the long term. So some of those key policy improvements that we've helped influence have been around housing standards, energy costs, disability allowance, obviously the winter fuel payments last year, and we're hoping two-child benefit cap, watch this space. Indeed. And in terms of the priorities, it's quite odd when you sort of reflect back, seeing as we're nearly at the end of 25. But in terms of our priorities, it is about continuing to strengthen that advice in community and health and community settings. So off the back of the work that we did it was funded from CCG and local authority pilot work in some of the GP surgeries, we've now just hoping to hear about a commission to work in Wansbeck General Hospital and the surrounding NPC PCNs, which would be quite transformative, I think, for some of those areas. Focusing on financial resilience, it is a very difficult funding landscape for the voluntary sector. We are a large charity for Northumberland, but we are a small local charity at the end of the day. And a lot of our funding is year to year, and that makes it very difficult to plan and to staff and things like that. So that's where a lot of my focus is as well. But expanding digital access, you mentioned, Paul, and I just want to mention for anyone who is coming to our AGM, we were really delighted to receive some funding from the Money and Pension Service to develop a new digital access point for money advice. So we've called it Mark. Where, we feel giving AI a name makes it much more personal, but it's a money advice remote kiosk, and we've developed the technology internally, and we're going to be launching it at the AGM. So we're soft launching it this week in one of our outreaches in Bedlington, East Bedlington Community Centre, and you'll be there to be able to play with it, so you'll be able to ask it questions and take it through, and the idea being that there's self-help triage, but then also directing to safe places of where there's advice and guidance, but then also that, importantly, that critical face-to-face digital appointment with a debt caseworker, all built into it. So we're very excited about that. And then building on continuous partnership working. We've been, a critical part of the inequalities work is working around this cross-sector and contributing the voice of our communities and our clients to that, through the work that we've done on Communities First and continue to do around supporting the micro-grants and hopefully the complex cases work that will come out in the next few months. These are some of our wonderful staff and volunteers. We celebrate Volunteers Week. That's what we put a little a little tea party on in each of our offices, and we celebrate the volunteers because, they get a lot out of it as well. Don't get me wrong, but we get an awful lot out of our volunteers. They're not free. They need training, they need supervision, they need support, but they are a huge asset. Thank you very much. Any questions?
Oh, thank you very much. Thank you very much, Abby. Are there any questions for Abby? Yeah, Carl, yes.
Thanks, Chair. Hi, Abby.
Hi.
Two questions. When and where is your AGM?
It is at New Biggin Hub on the 1st of December.
At what time?
12 o'clock. I'll send you if you haven't, because all of the county councillors did receive, but I'll send, it might have gone into your spam or something like that. I'll make sure you get one.
Also, I've got an ex-foster child who's 20 now, and she's having some problems. I've referred her to you a few times, but she hasn't gone. If I drag her, can we just walk in, or have we got to make an appointment?
No, you can walk in to any of our 9 offices. We also have additional drop-ins. Where are you? Cramlington.
I'm in Ashington by the Wansbeck Hospital.
Okay.
But the ex-foster child lives in Wallsend.
Yeah, I mean, technically, you know, we support Northumberland residents, but we don't turn anybody away.
Thank you.
Okay. Thanks, Carl. You asked my first question I wanted to ask AGM. So, any other questions to Abby? I have one question. Being a chair, I have to ask some questions. So, you mentioned savings across sectors.
Yes.
Is it over a year? Or
Yeah,
what's the,
that's the 24 to 25.
24.
Yeah.
All the stats
It's
are over.
all of the, based on the money that we've received from public funds and then the number of clients attached to every single one of those outcomes. So that's all taken from the casebook system.
All right. Okay. And
I'll send you all the technical detail behind it. I know
no,
you will.
no,
I know you will.
No,
want
no.
to
I
read
just
them.
wanted to know. The figures look so big, so I want to know whether it's over a year or 5 years
over 1
or
year.
something like that. So
It's over 1 year.
that's good. So this is according to a standard model.
It is according to a Treasury-approved cost
Approved standard
calculator model.
Okay. And of course, I think you have some, you and the other voluntary sectors will have some work in hand when if ever, two-child benefits cap was removed. I think most of our citizens will not be aware when it is removed, and we have to do a similar exercise we did over winter fuel allowance. I think so. I'm very pleased that you mentioned it, and you maybe is something we need to look forward to.
Yeah, we would expect it to be an automatic qualification, so we wouldn't expect people to need. But again, the devil will be in the detail. And because we have the LIFT tool, because we have the ability to triangulate our data, and because we're working collaboratively, we would look to work with the rest of the voluntary sector who are working with families and make sure that if they weren't aware, they would be made aware.
Yes.
Absolutely.
All right. Thank you very much. Are there anything? Yes, please.
I was just thinking it's really good to have a really good example of how the VCS organisations are linking into the outcomes of their joint health and wellbeing strategy, and obviously really clear links between advice and mental and physical health and wellbeing, and the communities first stuff that you've touched on. And I was kind of thinking about with your Thriving Together hat on, some of the other networks we've got, whether perhaps some representatives from them at some point sharing about the work from other VCS organisations as well.
Absolutely, that would be great. Looking at the forward plan.
Yeah, maybe we can take it.
It's you know, when we took over the contract, I talked to Jill about you know, maybe having a fluid representative like we do with the VCS liaison, where we get additional voluntary sector organisations. It is a lot. It is a big commitment, monthly, two hours for our voluntary sector colleagues. But if we knew what the topics were that were coming up, people would want to be able to come and certainly give that overview, because I'm sure it would be really helpful for everybody to hear, because there's some fantastic work happening at hyperlocal level, and we do hear a lot of that through the VCS liaison, but I think there is something about sort of sharing that wider.
Yeah, it would be good. Yeah. Thank you, Luke. Thank you very much. There are some hard copies of Abby's presentation here, so if you want, you can take one. And so let's move on to the seventh penultimate, I think, item. Health and Wellbeing Board Forward Plan. Please make a note of the plan. Looking into the near future, our next meeting will be a development session on best start in life, I think. So that's one thing. There is no urgent business for us to look at. And if you have any items that need to be discussed at the board level, please contact me or Jill or Luke, please. So that kind of brings an end to this meeting. I just want to remind you, next meeting is development session, as I said. It's on 11th December. Yeah, that's correct. So 11th of December 2025, not here. I was told repeatedly, not here. Don't come here. You have to turn up at the River Green Centre, Stannington. Some of you may be familiar with that avenue, but if you are a new councillor, a new member, please make note. It's River Green Center, and I think the details will be sent out. Please make note. Yeah. Thank you very much for your participation and contributions. Thank you very much. Have a very nice day. Thank you.